Okay, we had a couple of other people that RSVP'd, but we're going to go ahead and get started for the sake of y'all's time. Welcome to the December Newburg Strong Coalition meeting. This is being recorded, I guess, for the people who can't make it, or if you have to leave early or step away or want to just go back and review something. Welcome to everybody. I sent the agenda in the email that I just sent, but I'm also going to drop it in the chat for you all to have it. Sorry, I should have did that already. There we go. So you should, oh, it says there's an error. Oh, it's currently in use. I have to close the agenda in order to be able to send it. Give me a sec. All right, now it said it's sent. All right. Now open it back up. So for today, we're going to start out doing a year 2 dashboard review. So our grant runs on a cycle from September to August. So September 1st to August 31st. And let me share a screen. We're going to, just a recap of all the things we did for year 2. So moving forward to year 3, and also some updates. So there'll be some program updates at the same time. For instance, the compliance checks that we had, the information is in there. Some of our social media analytics is in there. But I'll go ahead and do that really quickly. Does everybody see my screen? Thumbs up, shake your head, something if you see. All right, good. So, all right, admit. All right, so Newburg Strong, this is our dashboard, once again, September to August. Here's our zip codes, once again, that we serve: 40213, 40218 in the Louisville area. So our updated demographics, most of the information that's like demographic information is going to come from the census, ACS data. So it's a 5-year estimate from 2016 to 2020, which is the most current up to date. So this is a little bit more up to date, but as you know, with data that's collected is always a little bit behind. So this is the most up to date that the feds put out for the census. And most of these charts, Newburgh's going to be in blue. That's our color, so it's easy to stand out. Louisville will be in the orange, and Kentucky is in the gray. So our numbers haven't changed very much, but this is total females, total males, and then total under 18. The majority of what we do in Newburgh is with the under 18 age group. We have more under 18 slightly than Louisville or Kentucky. But we also do some things with the ages 18 to 24. The college age is also covered under our grant. Here's race and ethnicity. This data pretty much stayed the same, even though they kind of changed some of the ways they collect some of the information. But they said that, you know, not to compare past years because of the definitions changes, but for most of these, especially with age, race and ethnicity, things like that, they stay majority the same. So you see Newburgh has more Black and African American population than Louisville or the state. We have more American Indian, Alaska Native, more Asian. So basically all of the minority populations, more Hispanic, more people who identify as 2 or more races or other race. We in general have more minorities than people who identify as a minority than Louisville or Kentucky. For our housing units, we actually have less vacant housing than the state, but more than Louisville. We know Louisville has a lot of vacant housing. But then we have less single family homes, but more multi-unit and apartment homes. We have more owner mortgage burden than the rest of Louisville, but not more than the state. So burden means that, you know, for most people, you should pay a certain percentage of your income for where you live. And it should be more than like 30-something%, 35%. If it's more than that, then that's a burden, and it's harder to be able to pay the rest of your bills. So for people who own their house outright, we have more mortgage burden than the city, but not than the state. We have less owner cleared burden because we have less home ownership. in general. And then for rent, we know rent went up at the beginning of last year. Rent was up like 17%, and it just went up and up from there. And so we have more people who are renting that are burdened by that rent in our demographics. Families and households, we have, so there's more foreign-born residents in Newburg than in the city or state, far more. But less of them are naturalized. That means obtain citizenship, but they are foreign-born, but they're not naturalized than the city, but a little bit more than the state. But the state doesn't have nearly as many foreign-born residents as Newburg does. Female households, that number stood out as well. We have more female households with minor children and no spouse. This is the same thing. They used to say female households, minor children, no husband. They just changed it to say no spouse. And we still in Newburg have more people that identify, more households that identify that way. And we still have less married couple family households and married. So that's married with children. We have less of those. We have more single family households where there's a single person leading the household. For language and disability, not speaking a language is not a disability. It's just easier to put these on the same graph. So I just want to say that, don't draw any conclusions of what I'm saying about that. But so in Newburg, we have far more people who spoke a language other than English at home. You can see like nearly 1 in 5 say they spoke in a language other than English at home. And we have far more people than the city or state that say that they do not speak English very well, who self-identify that they don't feel they speak English very well. We need to keep that in mind with our services and the things that we provide, make sure we're providing translations, make sure we're providing things in multiple languages. We haven't been doing that as well as we could because the top language that's spoken is Spanish. And then I know with you all in the school system that you all have a lot more resources for that. In those 7 counties, we have resources for that. But as far as the coalition, we haven't been translating a lot of things and we could. So that's one thing that we want to look into doing. As far as the disabled population, Newburg has less people who identify as disabled or are receiving disabled services. I'm wondering, and children that are under 18 that are disabled, we have less as well than the city or state. That was a number that was higher last time, are disabled under 18. So I'm wondering what changed from that, that we have less children that are identifying as disabled under 18. I don't know if that's just, if they're not receiving disabled benefits or if they're just not, or if the levels of abilities are changing. As far as transportation, Newburg has more people that use public transportation to make it to work. We have less people that walk to work. For one, we don't have what's called complete streets, so places where it's safe to be able to walk to work. But we do have more people taking advantage of public transportation. But we need to be aware of that with our programming as well, as far as offering maybe TART tickets or money for Ubers or things like that. Transportation is an issue. We do have data that I couldn't find before this presentation, before this dashboard, but our last dashboard did show there were less people who own cars than the rest of than the city and the state, but I don't know what that number is currently. That was for year 1. And work from home. So we have less people that work from home than in Louisville and the state. We know that during this time of the pandemic, a lot of things have shifted. A lot of people work at home. We know the jobs that aren't able to work at home usually pay less, usually have other issues with transportation, with childcare and things like that. So just keep in mind that we in Newburg, we have more families where people are working outside of the home and they're having to ride public transportation to get there more often. And so that also ties into when we do our programming. Do we still offer Zoom options? Do we still offer virtual options for parent programming and things like that? So keeping all that in mind. Next, we look at our poverty level. Newburg median income is at the bottom, is less than Louisville and the state. It's less than the state, but the state overall has a lower cost of living than Louisville. So Newburg is within Louisville and has a lower cost of a lower median income. That's an issue to add into financial struggles, especially now. These numbers were also before inflation and all that, because all this data comes the 5-year estimate, and there's a data lag, so we don't have this current year, but it's the most up-to-date data. So people in poverty, Newburg has more people in poverty than Louisville, but less people in poverty than the state overall. But for children, we have more children under 18, which is our primary population to serve. We have more children in poverty than Louisville or the state. So keeping that in mind, that the children that you're dealing with are likely dealing with financial struggles. We look at youth disconnection nationally, and we talked about this a little bit before. This number has actually was made worse by the pandemic as well. We saw that youth disconnection, that means youth who are ages 16 to 19 or 16 to 24, they're not in school and not working, that we were on a decline, but after the pandemic, that number shot up. So we need to, I put this in here too, again, just to draw attention, because when we did listening sessions at the Boys and Girls Club, one of the things that the youth were saying is that they wanted more opportunities to work. And these were youth that weren't the age group of like Kentuckiana Works that just didn't want to work over the summer. They actually, these are like 14, 15-year-olds that said that they want a job. And so we have, we're going to look at the numbers by race and gender here in a little bit. But in Louisville, this there's 13.4% of youth are disconnected in Louisville overall. That's about 20,000 youth. We look at Newburg, ages 16 to 19, the numbers, but Newburg had more youth that were not in school and not working than Louisville overall, disconnected youth in Newburg. By race and ethnicity across the board with gender and things like that, Native Americans are at the top. We do have more people who identify as Native American in Newburg than in Louisville or the state in Newburg, but the next level that our highest demographic after that minority demographic is Black, and then Latino or Hispanic has levels of disconnected youth, then our white youth, then our Asian youth. And this is broken down by gender. So next is an update on our alcohol licenses. So Metro ABC did a ton of alcohol compliance checks for us. Thank you, Metro ABC. We've been talking about that, looking for the results and talking about results as they came in. They are finished with their contract for that. So they actually looked at 402, 13, 18, and 19. So Newburg, for our grant, we served 13 and 18 just because we have to draw a line somewhere for our federal grant. But we know Newburg is loosely defined a neighborhood, and a lot of it does fall in 402, 19 as well. A lot of our schools do as well. And so, you know, youth don't just decide, oh, I'm only going to try to buy alcohol in 402, 13, or 18. You know, these lines are blurred, and they're, and so they did 402, 19 for us as well, just when they finished all the 402, 13, and 18. So we have over 210 active ABC licenses as of July 2022 in Newburg. So that's 46 locations in 402-13, 72 locations in 402-18, and 92 locations in 402-19. So we know if someone lives on Indian Trail, they don't mind to go to the mall in 402-19. These areas are very close to each other, and they do overlap. So that's why we did 402-19 as well. Just to know, if there is an application for an alcohol license, it will be on, Barbara Shanklin sends out a newsletter, a weekly newsletter, and those applications she includes on there, and we are able to say, hey, we have too many, we don't want this approved. They do take public comment, and so just know if someone applies for one, if you ask to be on any on her newsletter distribution list, that she does put on there when someone applies for a new alcohol license in her district, in District 2. So this is where I just mapped out all the licenses. So you can see they're everywhere, and it's different types of licenses. So all of them aren't able to get checked with the alcohol compliance check. So when they were checked, it was more like where you could go in and buy packaged alcohol and take home, that kind of thing, and like a gas station or a liquor store or something like that. Not necessarily, you know, if there's a church with an alcohol license to serve alcohol when they do bingo night or something like that. But so all of them are listed on there, different color coded, but you can see they're kind of spread out all over Newburg. There's an abundance of alcohol licensees. Then we get to our compliance checks. So the ones that were actually checked, 89 of those licenses were checked. That means an officer went in with a minor undercover investigative aid. We paid them through the grant. The minor tried to buy alcohol without ID. And if they sold it to them, it's considered a fail. If they didn't sell it to them or ask them for an ID, it's considered a pass. So these are the pass fail rates. And 40213, 18 licenses were checked and 11 failed, 11% failed. So that's like 1 in 10. A child has a 1 in 10 chance of walking into a place in 40213 and being able to purchase alcohol. 1 in 10 is too many. But then we go to 40218 and we have 1 in 5 failed, almost, over 1 in 5. So if they were to any, mini, mighty, mo, five establishments, they would be able to buy 1 out of 5 of those times. And then we go into 40219, which is just on the outskirts of what we consider Newburg for this grant. And it looks like almost 1/2, nearly, if you could flip a coin, you could probably purchase alcohol illegally as a minor. That's a problem. So for our service area altogether, for the one area that we're looking at, it's about a 1 in 3 fail rate, a 30% fail rate for the 89 licenses that were checked. This means we still have work to do, a lot of work to do. So red are fails, blue are passes, but some of them are so close that the dots are overlapping that you can't tell that there's more than one location there. For instance, I don't know if you can see my cursor, but you have areas where there's a red right on top of a blue. So someone could fail and then walk next door and could not get a sale and then walk next door and have them sell to them. That's how close it is. It's that alcohol is everywhere in this community, and there's an abundance of licensees that are willing to sell to our kids, unfortunately. So this was done last year. I don't remember having a presentation from Taya, so I just took a few of her slides to put in our dashboard. She did an alcohol outlet scan, and so we went out as staff, we all went out and took pictures of all the different alcohol establishments, and she put them together in a presentation to kind of show us an environmental scan of what's going on in Newburg, of the advertisement, sorry. So this is from Taya. She says, as you walking through Newburg, it would look something like this. So there's a lot of different alcohol advertisements. There's rules about how much advertisement can be on the outside of a building, but there's we know that increased advertisements mean increased youth use. And so this is what it looks like in Newburg. Here's some more. There are some more slides. It just went on and on that there was alcohol advertisements pretty much everywhere you go. But she one of her conclusions is that alcohol availability and advertisements are disproportionately in racial and ethnic minority communities, that all communities don't look like this. Youth may be used to in Newburg just seeing everywhere they turn, just seeing alcohol advertisements, but just know it's not this way in every part of the city. And so it's a problem that we need to address in not having so much alcohol advertisement. Moving on in our dashboard, we had October, there was Red Ribbon Week. I know a lot of things, I know COVID was starting to go back up, the numbers. A lot of the things that we did as far as the coalition this year is just send materials directly to schools, and the schools handled Red Ribbon Week within their schools. And so Rebecca, the former director after John, coordinated just getting things to the schools, things that you all wanted or requested for your school to pass out. So we did a social media survey of social media trends this year, and we did this to see, before we started upping our social media presence, we'll talk about the analytics from that in a little bit. We wanted to ask the youth, what were they using? And so there were other questions, but this is just the first one. What social media platforms do you use? This just gave us an idea about what are they using? Are they using more than one? Do they like some more than others? And what were some trends that they saw? And so we do plan to do more of this this year, just to see what the trends are. So if we put out an ad that we want it to be trendy and something that they're going to click on and look at, but also have a message. This year in January, we also did an environmental scan for alcohol density and distance. And so these are just quick updates from that. We still did 402, 13, 18, 19. And we looked at Newburg schools, daycares, childcare, churches, faith-based organizations, parks and recreation, things like that. And we wanted to see how many of these places were a mile or less from a licensee. And these were the results from that. You can see there were alcohol licenses near just about every school, every daycare, every church, we're just inundated with them in the community. This was done earlier this year. And we can see also, the number of alcohol licensees, and this is just 402, 13, and 18 without including 19 on this chart. just the number of licensees compared to the schools, compared to the daycares, compared to the churches and the parks and recreation. This includes Boys and Girls Club, community center, the library, all that, compared to the number of alcohol licenses that we have. This shows kind of what's important in this community is not what can help our kids to thrive, but, you know, serve in the alcohol industry. We also had a positive social norms campaign. I don't know if you all saw these around. So it was made to look like a TikTok ad, a TikTok video. We had billboards, we had bus shelters, we had mobile ads, all to say with this message, our positive social norms message. And this data is from 2018 KIPP data, which is our most up-to-date KIPP data. Most youth say that they have better things to do than weed. And so we actually gave the message to the kids, we gave the data to the kids, let them develop a message and what they wanted to say. And basically this number shows the past 30-day use marijuana, that there were more kids who self-reported that they didn't smoke weed, that smoke marijuana, use marijuana of any kind, than youth that said they did. And so this is actually data-driven social norms message. And then the message was be the change you want to see. This went on all of our social media sites as well. And there was a good reception because these are actual Boys and Girls Club kids. These are Newburg kids. They're not, you know, stock photos or whatever. Actually went on location and took those pictures. And so, you know, when they see somebody that they know up there, that's more likely that they'll look at it. And because they're used to looking at TikTok screens, hopefully that grabbed their attention as well. So Outfront Media gave us some sites, and the viewership at IMP is impressions. That's a number of impressions that came from each site. So the bigger the bubble that you see here, the more impressions, the more people that would have saw the billboard or the bus shelter at that site. This doesn't have the mobile ads. These are just the physical locations around Newburg and how many people would have saw it. It was a 4-week campaign. We did an 8-week campaign, but for every 4 weeks, this is the number of people that saw it by race, ethnicity, and age. And so these are impressions by race, ethnicity, and age over that 4-week period. So you would multiply it times 2 because we did an 8-week campaign this time. These are the mobile campaigns and how it breaks down who all sees it, the different zip codes. It does a geolocation of the people who click on it. When they're inside of those zip codes, it'll send them those ads. And so these are kind of what the numbers are for those. Also 420 in 2022, there was the Real Action Video Contest. It was a very successful online video contest, and we had 3 videos was submitted from Newburg Strong, and 2 of them actually won an award there. So congratulations for that to Newburg Strong and to the youth who did it. This program is by youth and for youth. And so it's also going to be another one, and we're going to look to participate in that in the upcoming spring of 2023 as well, and hopefully get some more videos. So the premise behind this is that when kids participate in doing these PSAs and developing them, it actually decreases the chances that they'll use alcohol, tobacco, or marijuana. And so this is a prevention strategy to have them participate in these programs and to watch their friends that are winning awards and things as well. We also had a town hall meeting on marijuana, talking about policy, marijuana policy impacts on communities of color. We did that in the spring of 2022. It was a successful town hall meeting. We do know that this legislative session, Kentucky did approve medical marijuana. So we were kind of hoping that we don't know what that looks like. And it's too nuanced to talk about right now. But we did, before that happened, we did have a town hall meeting to talk about the impacts on communities of color. And there was a successful, it is recorded and on our website if you want to see it. If you weren't able to make it to that town hall meeting, it was a good one. We also have a new website, newburgstrong.com. If you haven't been there, go out, check it out. All of our old, not all of them, but our coalition meetings are on there. The resources are on there, different things. But anyway, these are some analytics from our website just to see how, increasing the number of views, the number of visitors over time. It's a really new website. So the amount of traffic that we have right now is really good. And, it also sends people, it tells you how many are sent there from Instagram, from clicking on one of our Instagram ads, from clicking on one of our PSAs on Facebook. It drives people to our website. Here's our Snapchat analytics. These are from August. So it's only and it breaks it down by age. You can see 13 to 17-year-olds, 44% of the people that are coming to our Snapchat. So it's really good. The number of impressions, males and females, it breaks it down over there. So this, if you want to look at all this, is going to be on our website as well, or on our Google Docs. So you'll be able to go back and look at any of this if you didn't get to see it. Here's our Instagram and Facebook analytics. This is just for August. We have for the entire year our analytics, but I didn't put it in this presentation just to show, in 1 month how many we had. You see the numbers are going down here, and that's because we actually took off Facebook and took off our paid ads from Facebook and just started focusing on Instagram, TikTok, some other ones. So that just reflects that we changed our strategy, not that people weren't interested anymore. We also had coalition meetings all year long. We only missed one, I think, and that was in October. So kudos to everybody who keeps coming to the coalition meetings. So we did coalition development, we did youth social media surveys, increased our social media presence. Once again, now we started out with Facebook and Instagram. Now we have Twitter, YouTube, Vimeo, TikTok, Snapchat. We provided evidence-based curriculum to the schools. We're still doing that. Please let us know if you want any of that. We continue things with coalition name recognition, going to different booths, going to different tabling activities. Operation Parent Handbooks, we purchased, so far we've given out 250 of those. We have more if you'd like to provide those to your parents. It's a really good book, handbook. They're about $20 a piece, but we have money for the coalition if you want some to pass out. We did focus groups in the summer at the Boys and Girls Club. We did one for adolescents and one for teenagers. We did SBIRT screening, brief intervention and referral to treatment, which is very highly effective in reducing use, evidence-based. We did that for college students at the University of Louisville this year during one of their back to school events. We work to reduce disparities in mental and behavioral health. This is a part of our grant. We don't get to talk about it enough, but SAMHSA does require that we do this. So we worked with the Kentucky Minority Mental Health Initiative. We helped with the National Minority Mental Health Awareness Month. The 7 counties has a racial equity, diversity, and inclusion group that staff members serve on. We also have equity, diversity, and inclusion recruitment task force, and there's other activities that we've done to reduce disparities. Family First Dinner Table Project has been a successful program, and we've had some Newburg families to attend and participate in that. We did family togetherness boxes that had family games, information for parents, conversation starters, all that. At least 100 of those were put together and distributed this year. And it's a nice size tote box full of materials for families. Parent Power Kits, over 1,500 of those distributed. We provided youth ice cream socials at the Boys and Girls Club, where we talked about substances and prevention. We started a photo voice project, wasn't quite successful, but we do have a plan to make that more successful for the next one. With logistics, we sponsored the end of the year cookout at the Boys and Girls Club. There's potty talk ads that, Rebecca's already shared about those. Those were, some of them have been distributed already. We had superhero drug prevention comic books. If you want some of those, we have some more of those. It includes information in there about vaping and whatever, but it's a superhero. They're really cool. I was going to put a picture on here, but it says that it's confidential. They don't want us sharing their materials if somebody hasn't purchased it. So I wouldn't be able to put this online if I put a picture of the comic book. But we distributed about 100 of those so far. We have more. And the Mendez Foundation is Too Good for Drugs. So we have schools that are implementing that right now. And so that is it. Let me stop sharing. Are there any questions? I know that was a lot, but we did a lot in year 2. Any questions? Okay, next on the agenda, I can pull it back up. Anybody, if you can stop, unmute yourself at any time. And sorry, I'm trying to pull back up the agenda and I've got too many things open. Okay, my mouse is moving on its own. I'm wondering if I have a virus. We'll see. Okay, I'll take this moment now to, it's not next on the agenda. Oh, well, here we go. All right, so we have our, for sustainability, we are partnering with NAMI to be our fiscal agent, NAMI of Louisville. And so we're going to apply for a drug-free communities grant in 2024. So not this year, this upcoming application, but the one after that. And so if you want to be a part of putting together the application, of writing for it, then we're going to start having meetings. We're going to have our first meeting this afternoon, just to kind of get some ducks in the row. But then we're going to start meeting regularly outside of the coalition meeting if you want to be a part of writing for that DFC application. If you're not familiar with DFC, I can give you more information offline. I can email it to you. But if you know, it's the Stick Coalition in Shawnee, they're a DFC. The one in Graymore, Devondale, my Cameron Middle School, they're a DFC. There's DFCs in all the rural communities, and it would be great for sustainability. It's a 10-year grant, and so it could continue the work that we're doing with PFS once this PFS money is gone. And so we're really looking forward to that. And thank you to NAMI of Louisville. Bryson, is Bryson on here? Did you want to share anything about that?
No, thank you so much, Brittany, for doing that introduction. But yeah, we are really excited to work with Newburg Strong on this DFC grant for 2024. So that's all we really have. I know we're gonna have a meeting today. I would love for everybody on the coalition team to be included. I think a lot of things that we're wanting to do is really bring, I mean, like we already know Newburg Strong has been doing a lot for the community. So I think we just want to do a lot more, you know, and especially with the mental health side of it. So I definitely know that with Newburg Strong, it's more of the substance use. So I know that we want to bring more of the mental health perspective of it to the to Newburg Strong. So I'm very excited, Brittany, about this.
Thank you. Thank you, Bryson. Next is staff vacancies update. So we still are looking for a program specialist. If you know someone, please let us know. We also have an application open right now for an intern, a paid intern. So the state pays them, they pay them well. I think they may pay more than we're able to pay here at 7 counties. I've heard good things about the pay. But if you know somebody who wants to be an intern, I have an application for that they wouldn't be a 7 counties employee, but they'd be an intern from the Department of Behavioral Health to work with Newburg Strong. And then we also have a new PFS director. Yay! Welcome, Malcolm Bird. So he's on today. His first day was yesterday. He's getting acclimated to his new job. Malcolm, would you want to share a couple of words?
I just want to thank you, Brittany, and I just want to say I'm happy to be here and I'm looking forward to moving forward. So yeah, I'm feeling good about being here. Thank you.
Wonderful. So as you know, we had John, we started out with John. John moved up to the state, to the Department of Behavioral Health. He still came to our last coalition meeting. He's still very much involved, but he's at a different level now. Rebecca left us in the end of September. And so that's why we didn't meet in October. And so now we have, for December, we have Malcolm. So welcome, Malcolm, again. And next on the agenda, you all will start getting emails from Malcolm Bird. December is National Drunk and Driving Prevention Month. So kind of there's an awareness month just about every month. That's what it is for December. And so if you saw last month, our social media sites kind of included, I forgot what the awareness month was for last month, but I know we did it. And so this month you'll start to see things on our website about and on our social media about drunk and drugged driving prevention. And so please like it, share it, comment on it, all that stuff on your different sites, or post things on your page that we can like, share, and we would appreciate that. We still have evidence-based programs. I put on there the discussion is continued because that's going to be a big part of this year, getting our evidence-based curriculum out there. If you still want programs, please let us know what you want, how many of them you want it for. If you want more information about a program, let me know. But we have the money to pay for the curriculum, to pay for the training. If you want to train teachers staff in your school. We also have a partnership with NAMI that we discussed last time, where Bryson is actually trained to do some of these programs, and that he can come to your school and deliver them for you. So your staff can grade papers while he provides the trainings, or, you know, some of them might be 10 weeks long for an hour each time. Some of them might be just 1 hour for one time. So there's a lot of different ways that these programs can be implemented. We can train your staff, we can bring in trained staff. Let us know. We want to be sure to get these evidence-based programs, things that have shown to reduce youth substance use. We want to get it into the hands of the schools, the clubs, the church groups. If you have a youth church group that wants to be trained, if you have connections with another youth group, let us know. Alcohol compliance checks update was already in the dashboard. I'm gonna skip that. Now community updates. So I'm gonna mute myself. And if there's anybody that has any community updates, anything's going on at your school, your program. I think we have, I think we have another town hall meeting or something coming up this month. I'll mute myself. Mr. Duncan, is there still going to be a town hall meeting? You might not be able to talk. Okay. If it is, you'll get an email or something on social media about it. Anybody else? I don't want to give y'all too much silence, and we might get out of here early. If you ever have anything you want to get out to the coalition, send it to Malcolm. I was gonna say me. Send it to Malcolm. Malcolm, can you put your email in the chat, please? And he'll probably also do like a welcome email to the whole group. I need to get him over the contact list. And you can send stuff to Malcolm if you ever have anything to update the coalition about, or whoever the new program specialist is going to be when they get on board. Once again, CACA National Leadership Forum is going to be next month, the end of next month into the beginning of February. If you'd like to go to that, please let us know. Malcolm, remind me to talk to you about that if that's one that you want to go to. And it's
Thanks, Brittany.
What's that?
We'll be talking about a lot of things.
Yeah, but I'll forget about that one if you don't tell me. Oh,
yes, ma'am.
And wait till Greg connects, and I'm gonna ask him if he has any updates, because I think he got disconnected. Hey Greg, do you have any updates or anything that's going on with Peace that you like to share?
Sorry, I had to get off for a second. I had a phone call I had to make.
I figured, yeah.
No, first I want to say congratulations, Malcolm. I heard that part, and then that's when I had to get off. Not really. I mean, Peace, we're busy. You guys all know how to reach out to me. Hopefully, if you have any events coming up, whatever, and you like Peace to be involved, please reach out. There's actually an event at Phoenix School Discovery on Thursday night. I'm working that event, so it's something I have going on, and beyond that, we're just trying to get ready for the holidays. There's a lot going on. We just had our Boots and Barbecue event, which is our big fundraiser for the hospital. We had that on Saturday night last week. We raised about $59,000 after expenses. We raised a little over 100, but then there's like 40,000 in expenses. So it was a big event. It's at Millwood Arts Center. We had about 350 people. So a lot going on. Good to see everybody.
Wow, that is awesome. Congratulations on that big haul. That's great. And I know you all do good work there. Y'all do great work there. And Greg he's a busy guy. Y'all will see him everywhere. Malcolm, I don't know if you know Greg already, but he actually used to work at Peace. You might know each other.
Yes.
Yeah, I know
Very
Malcolm
familiar.
back in the
Oh,
day.
yes.
Okay.
He's fantastic.
He
Big fan.
is, yeah.
He can't shake me off of him.
And if Greg says you're good, I trust Greg. All right. All right. And so lastly on the agenda, it's going to be on, hopefully the agenda's moving forward, a digital suggestion box. You can either scan the QR code, click the link. That if you have any suggestions for Newburg Strong, please send them to us. Anything about what to do for year 3, year 4, what to do about the DFC grant. Those are monitored. Please submit any suggestions that you have. You're also welcome to just email, text, call, whatever. But if you want to do it anonymously, or if you want to do it on the fly while you're thinking about it, you can use the digital suggestion box. And then the meeting evaluation. I already know for this evaluation, you can go ahead and scan it in and put it that Brittany talked too much. But Brittany's not going to have to do these meetings anymore. I'm going to turn these over to Malcolm starting January. But we did have to do our dashboard. Normally that would be my job. I'm the evaluator and epidemiologist for the coalition, but I wouldn't normally be doing the rest of the coalition meeting. So the reason I talk so much is because I was doing two things at once. But things like that, if there's too much talking and you'd like to be more interactive, if you like this to be more of a working meeting or have less meetings and more working meetings in between, or whatever your suggestions are, meeting evals, we want these to work for you and to be beneficial to you. And last but not least, our next coalition meeting is January 3rd, 11 o'clock a.m. Same place, same time. It'll probably be through Zoom. We will eventually start going to hybrid meetings. I know that was something that was discussed about moving back to hybrid. But some of you all won't be able to get away from your location and you still want virtual, and some of you all want to be in person, whatever works. So everything doesn't work the same for everybody. So we want to be as inclusive as possible. So we will eventually move to hybrid, half in person, but have a Zoom option as well. So if there's nothing else, I think 47 minutes is awesome. We didn't even make it to the full hour. I don't know if you all feel the same way or if you feel this is information overload. But if you have anybody else have any last words, anything they want to share? I hope everyone has a wonderful holiday, Christmas, Hanukkah, Kwanzaa, whatever it is that you celebrate with your family and friends, and that you're safe. And we'll see you all in January.
Thank you, Brittany.
Thank you.
Thank you.
Thanks, Brittany. Just want to say welcome, Malcolm.
Thank you, Ashley.
If you need anything, JCPS Flag, feel free to reach out. I stay pretty connected with the FRC group, and they're going to be your go-to people for programming and stuff in the school building. So I'm in a new role as your safety admin. So I do get some drug
Yes,
calls.
and Ashley, thank you for helping with interviews. That was, I mean, that's extra. It's on top of what you already do for the coalition. I love your hat. Thank you so much for helping with interviews. And if anybody else wants to help, we still have to interview for the program specialist and the intern. And we need to have coalition members on there, not just 7 counties doing interviews, because they don't know the work that we do in the community that we work with like you do. So if anybody wants to be on those interview committees, please let us know, and we'll tie you in as a coalition member to help bring on the additional staff. We want to make sure they're a good fit for the coalition.
Brittany, just let me know when the interviews are.
Okay, great. We'll do. We'll do.
And I also agree with the email change that y'all were sending yesterday with the candidates. I didn't reply. I think I tried to like it on the little Microsoft app. I'm trying to learn how to use the reactions. But I agree with the 2 candidates that you all had said.
Okay, good. Yeah, I think Dodie called it good. So that will probably be, Patty will probably give them a call and bring them in for an interview if she can, if they're still interested. All right. Thank you, everybody.
Have a great holiday break.
Thank you.